Can you briefly go over the difference between anxiety and depression? Because I know in your book you talk a lot of these studies are talking about depression because that's what they're looking at. But there's a correlation between anxiety and depression, and these different foods are helping with both. So what's the difference really between anxiety and depression?
It's a great question. I think one at a kind of neurological level, the circuits and kind of what they do and how they feel to us as individuals. So with depression, we often think about depression as mood, but a lot of the symptoms of clinical depression are things like low appetite, poor sleep, weight gain, things that sometimes people don't kind of consider as part of depression as much.
Right.
But generally, depression, I think, is kind of the volume gets turned down for people. You see things in a more negative way, in a darker way. Sometimes people have more sort of suicidal thoughts, or I often think about it as a disconnection. Right? Like when we're feeling well, we feel like connected to people, then we feel almost, that feeling when you're really like feeling it, right? You know that feeling, Joey, when you're feeling it.
Well, when you're feeling it, yeah.
Yeah, where the volume's turned up on your life. Things are
Yeah.
colorful, food tastes great, relationships feel good, you feel good about yourself.
Yeah.
And depression, in some ways, I think, is the volume's really down. You don't feel good about the people in your life. You're feeling a lot of separation and distance. You're having a lot of sadness and irritability. And for men, certainly more shutting down.
Yeah.
I think there's this idea that men don't get depressed as much. And I don't really think that's true. I think that's a horrible misnomer, actually.
Mhm.
I think that what depression looks like in men and in women is a little different. But depression is a classic mood disorder. That mood is in the lower register. There's also the dysthymia, where you don't get dysfunctionally depressed for 2 weeks, which is a depressive episode lasts for 2 weeks, but you have a chronically low mood. You're able to function, but you're just like, meh. You feel like 4 out of 10.
Right.
Anxiety is more around worry, hypervigilance, being on edge. And usually anxiety falls under this generalized anxiety disorder where you're worried about most stuff, lots of stuff, everything. There's social anxiety where you're okay, like here in my office or with my family. But when you put me in a social situation, I really have a lot of symptoms. There's panic disorder, which things are fine. Then people have acute panic attacks, which usually the hallmark symptom is a feeling of impending doom, and then usually respiratory, sort of shortness of breath and racing heart. Panic attacks really scary.
Yeah.
And then there are acute phobias, like but the classic is sort of the generalized anxiety disorder, and people having a lot of catastrophic thinking, playing those bad, scary movies in the, so I tell my kids that, the movies with like the bad clowns in the van, like too many bad. So those are all symptoms of anxiety, really also in there being really worried and preoccupied of like what people think about you and your actions is also kind of one of the common anxieties that I see.
Yeah, there was a quote in your book. I think it was one of your patients said it. Something about depression is the loss of color in a day.
Yeah.
That's really good, and that's kind of what I feel like sometimes. I never say I'm cured from depression, right? There's some days I just wake up and I feel sad, and I don't know, like whether it's getting a book deal, which I just got last week. Yay me!
By the way, that always makes me sad, Joey. I mean, you say that joking, but I filmed a course, my first like big e-course. We scripted it. We have like production. It was awesome.
Yeah.
I filmed for 2 days straight. And usually when I finish those things, I know myself now. I don't like this about myself, but I usually tend to feel a little down.
Yeah.
A little like spent and a little questioning it. So I don't know if maybe that's partially from you got a book deal and you've been pushing for it and it's amazing, but it's also, it's a complex thing to achieve things. So,
yeah, it is. It is draining, from that. And it's funny.
Wait till you do the book. Wait till you do the book promotion, Joey. I'll see you soon.
Yeah, right. Like it's really interesting because I had 3 book meetings, and you know the whole process. And my agent, she's great, and the 3 meetings went really well. And then I got 1 offer out of 3. And instead of me looking at it as like, man, I got 1 book offer, I thought, right, what happened to the other 2? And then I start going down this like rabbit hole and then my wife's like, you just got a major publishing deal. This is a big thing, So I think that, and then when I filmed my program with OpenFit, openfit.com/Joey, shameless plug. With OpenFit, I had like 20, 30 people around me all the time. Like, what do you need, Joey? We're doing this, and cameramen and PAs and my own assistant. Yeah. And then I go from there to when we talked about this in the pre-interview, And I went to quarantine myself for a couple of weeks because this is in January, the height of things in LA. And I go from all these people waiting on me hand and foot. And I was just, it coincided with my birthday. I turned 38. I'm like, wait a minute. And all these people, it's my birthday. I'm by myself. And just for days, I just felt like shit. And everybody's like, you should feel good. You
should be reading. You should like learn a language.
Right.
You know? Like you got this time to yourself. What a gift.
Yeah. I slept for days. I just slept because I was just wiped out, and like those depressive thoughts started coming out. So then you kind of try to get out of it and, do some different things. But that's why I think this book is so important for people, because one, we don't ever, I still think that we don't look at food as something that can help fix us, or I don't want to say fix, right? To help some of our symptoms.
I just say like help us, I think so often food is our enemy, whether it's the salt or the cholesterol or the calories. It's not like this energetic compatriot that we absorb and use for good, and that by picking the right ones, maybe we can do a little better. Joey, it's really meaningful to me to because you have depression, because I think that one of my fears always is that, so often I'm certain you've seen this on the internet, right? Where this stuff gets used is like, oh, there's this one toxin, or like, oh, all you need is the kale. And then there's no need, yeah, of course you're on Zoloft. You don't need kale. And
you talk about that in your book. Like you can do all this sort of stuff and not have a piece of kale or something like that.
Yeah, you can. And also you can do all this stuff, right? And still, as you're noting, I'm sure you work out more than anybody listening. You certainly work out more. That's one of my favorite antidepressants. And
yeah.
You're doing all kinds of great stuff. You quote unquote should be feeling great. I think just to talk that around the notion of how our minds, whether we have depression or not, can are something we need to get a harness on, and then around how food can be a really, really important factor, and that it is overlooked. Right? I often see this where people just have not, as we take a psychiatric history, as we think about our mental health, that it's not the only thing, but we just we don't really put that in there yet. And I hope the book helps change that of like, all right, what have you been eating over the week?
Yeah.
Because I guarantee you times that you're probably feeling more depressed, it's been a time that you maybe haven't gotten a chance to attend to your food, or maybe it's not just the food, right? Sometimes I'll eat healthy food. I still won't feel that great because I haven't actually like sat down and enjoyed a meal. Or for me, cooking for other people always makes me happy. Makes me a little neurotic, but like I just like it. Like I don't know, it's like I'm not the most giving person in lots of ways, but in that way, like I like to cook for you. It's like, and if I'm traveling, sometimes I'll like get to my kitchen, all of a sudden just be chopping vegetables. I'll be like, wow, I've really like this is part of why I haven't felt right, is I haven't been engaged with this. So I'm curious what really works for you.
Yeah, it's funny. Look at that. You turned the podcast around on me. What works for me? One, I think being aware when I feel down and telling others when I feel down. So if I wake up and I have one of those days and I just feel like shit and I can't explain it, everything's going right in the world for me, and I can't explain it, then want to tell my wife to say, hey, I'm in one of those moods today. I can't explain it. So then telling her, or crashing with my in-laws now as we sold their place, or if I tell them I'm just not feeling good today, then they know it's nothing that they did and they're not trying to fix me. I think like everybody's like, oh, you'll be okay or feel better. Like
it's a really important point, Derek.
Right?
So often when people feel like they say something, it's like, I don't want to say anything because then I'm going to get all this attention. And it's like, well, what, when you're like walking around looking down, like you're in a bad mood, like you're not going to get attention that way. Like you'll get tons of attention. Everybody's going to want to like help.
Yeah. I mean, that
you just say it like that. You just sort of say like, hey guys, I'm not feeling great today. I'm going to be back on my feet soon. Yeah. Just like wanted you to know, kind of like,
yeah,
love you. And like off you go to do your thing.
Yeah, exactly. So you let them know. And then right there, one, maybe they're having a bad day, or maybe they're more aware of what they're going to say around you. They're not trying to fix you. So then if I'm not reacting the way I would normally be or as happy, then they realize like, oh, it's nothing that they did. It's just like, I'm in a funk. And then I'll go into, I'll try, I've been trying to get into some more like gratitude and being aware of the things that are good in my life. And then I have to get some sort of movement in earlier in the day. Wait an hour and a half, maybe have a cup of coffee. Make sure
then you hit your movement right away.
Yeah, I hit the movement right away. And because then that gets me going. Often that will not completely fix it, but make it so much better and more tolerable. And then I can go on with my day. And then I make sure that I know that things don't make me feel good. Like I don't really drink ever. I think I've had 5 drinks the entire, calendar year, if that. So, I'm not going to do that because I know how it makes me feel. And I know how these bad foods make me feel. Or if I go and grab, pretty much everything in our house is organic and whatever, even it's chips. But if I'm having like a big bag of chips and something else and I overeat, I know I'm not going to feel good the next day. So I'm aware of that. Or on the other end, sometimes I allow myself to have that cheat meal or bad food and be okay with it. Like, hey, I'm going to do this. I'm going to be okay with it. Because before I used to kind of beat myself up about it.
Right. Kind of like you take away the pleasure of it because
Right.
it's like, yeah.
Right. So, that's really what helps me. And then making sure I get my sleep and go to bed and wake up at the same time every night, get some light early in the morning in my eyes, do all these sort of things. And I'm fortunate enough to have like world-renowned experts like you and other people on the podcast that I pick up these little things from and I start implementing them into my life. And that's a little prelude of what my book's going to be about, just so people know.
I hope you talk about. I'm excited for your book, Joey, and I hope you talk about your mental health in there. And I really encourage you to, just as somebody who embraces a lot of lifestyle changes, and it feels like you're doing the mental fitness game really well in terms of focusing on sleep and nutrition, and then I like that you frame it appropriately of us all being works in progress.
We're always
your mood's always good. It's that you have tools for when it's bad, and they work more often than not. And I think that's really important to emphasize.